Welcome to MedHeads, the weekly show that brings a biopsychosocial focus to issues of the day, along with special guests who will showcase their expertise and enthusiasm about their field of practice. Your host, Dr. Fergal Armstrong.
Hello again, welcome to MedHeads, and today once again we have Anita Fletcher of Stand Out Medical Careers. Hello Anita, how are you?
Hi Fergal, I'm really well, thank you.
Good. It's good to have you back. So exploring our discussion on the interview and how to prepare for the interview, there are a couple of things that I wanted to ask you, like the really horrible interview questions such as, tell us about a time when you've overcome a challenge. What's your thinking around that statement or that question?
Okay, well, I always suggest preparation, as I said in the last session that we had, in the last discussion. So, I mean, everybody can do some preparation around this question because everyone's experienced challenges. So, I would come at it from the point of view of that past challenges, as your question relates to. Potentially current challenges that people are working through, and then what also think about the question you might be asked, which might be, what challenges do you foresee in taking up this role? So in doing those three are the past ones people are looking at. They want to hear from you an honest account of your experiences and demonstrating the way that you manage difficult situations and the way that you work with others to get through that. And then currently, are there any current challenges that you're working through, and what plans do you have in place? What strategies do you have for coping with those? And a lot of people out there are facing many different challenges. So there's a lot of food for thought for people, and I really encourage people to refer to those experiences and reflect on those experiences as they're happening for future reference to use in interviews. And then thirdly, that question around what challenges might you expect if you're successful in attaining the role, because the recruiters want to know how much you've thought through what the role entails and what some of the hurdles might be, which really demonstrates the research that you've done into the position and the organisation.
So what I'm hearing is you need to think of challenges as past, present and future. And you need to come up with an example in your own life about how you've met a challenge and currently what challenges you're meeting, and then do your homework to foresee challenges. So let's talk about challenges. What kinds of challenges have you heard discussed in your experience interviewing? Interviewing clients?
Well, we know that people can be challenging at times. So frequently those questions relate to people that you've worked with. They might be patients, they might be peers, they might be seniors, people in senior roles to you, and how you've managed those rather often fraught interpersonal interactions. So they're looking for the way that you communicate, that you assess the situation, that you think through and plan through what the approach is going to be in order to most effectively come up with a resolution to the issue. So the challenge is normally going to be there's an issue for people, and people want to see a way out of that, a resolution. And then secondly, in terms of, as well as people, and often hand in hand with people, is the situation itself. So that might be a clinical problem or a workforce problem, or it could be other resources that are difficult to access. One of my clients at the moment is about to head off overseas to work for MSF and doesn't know where he's going yet. And I think that's a very interesting situation of not knowing, one, where you're going in a month's time, but also what on earth you're walking into. But it can be pretty much safely assumed that wherever he's going is going to be far less well-resourced than his current major hospital in Sydney that he's been working in. So obviously he's pondering the challenges that lie ahead and how he's going to, what resources of his own is he going to be able to draw on in those settings, and then what resources will he have to learn about that are around him. And essentially anyone, even if it's not as drastic as sort of example, anyone can be faced with those sorts of resource issues at any time in their work. So I think it's always healthy to kind of think through those worst case scenarios and have a plan in place, or at least some kind of structure, and some talking points around what you would do if faced with those sorts of situations, with any challenges, people or resources.
That's an interesting breakdown of challenge. People are resources and resources are internal and external. So there's a lot to tease out here. Let's go back to people. Oh, and by the way, I presume MSF means Médecins Sans Frontières.
Yes, that's
Doctors
right.
Without Borders, yeah?
Yes,
right.
yeah.
So let's go back to people. How do you deal with a difficult superior colleague? Because everyone knows how to deal with a junior or even someone on the same level. But how do you deal with a difficult senior colleague who just doesn't get what you're trying to do, or who has unrealistic expectations of what you can do?
I'd say tactfully, without giving up your ground. You know, a lot of people are often intimidated when they've faced with that situation for good reason. They're worried about, not getting good feedback, not having that person speak badly of them to others, and a whole other list of potentially unfortunate consequences to that situation. So my advice to people is to really think through what are the issues, what's the situation, and come up with an action plan, and not rush in and try and resolve that too quickly with that person. So give it some thought. And then, but, when I say too quickly, maybe not immediately, but as soon as possible, approach that person to have an initial conversation with them about whatever the perceived or real issue is, and try and hear their side of the story. There's always two sides of a story. Sometimes people can get stonewalled at that point, and they can be very frustrated. They feel they're not being listened to, it's going nowhere, or they're being ignored. I've heard of people being met with the hand, not going to talk to you about it, go away. So that's a very difficult situation to be faced with when you're working in a professional environment, and one where your whole career could be quite adversely impacted if it's not resolved. So I always say try and resolve the situation with the person involved first, and then talk to some other people, recruit, enlist help. When it's someone senior, there's always someone around you in a hospital or in any other medical practice workplace. It's usually a team situation, and there are other resources and people you can go to. And even, I was working for the AMA. People would bring these sorts of issues to the AMA. They would bring them to the union as well. But usually they start by approaching someone within their organisation and saying, I really need some help with this. So, and that's what I'd strongly recommend, that people don't try and deal with those stressful situations on their own, and to ask for help from someone, because chances are most people have experienced that kind of behaviour or situation at some point, and everybody knows it's not a good place to be, and it's in everyone's best interest to resolve it quickly. But it can be incredibly complicated. One doctor came to me a few years ago at the AMA and said that her supervisor that she'd been working with for a few years and doing a lot of research with had suddenly turned against her, and he was her main referee. So she had a fairly significant problem all of a sudden, and she was doing a wise thing. She was talking to a few people to say, how can I possibly navigate this? And if the worst case scenario is that this person, the conflict is not resolved, how can I find other referees so that I can reasonably explain to future recruiters why this person is no longer my referee? So, there's often very delicate, complicated situations surrounding these sorts of issues. So, I'm big on clear communication, so try and work it out. But at the end of the day, there's also, wherever there's people, there's personalities involved, and sometimes personalities will never gel. There are some people who will never sort of like other people that they're working with, but the key is that they don't all have to like each other, but you have to be able to work with each other. And if there is a conflict, try and move on from it in the most professional way. And sometimes if it's a shorter term engagement with this senior person, if you're a junior doctor and you're looking, you're on a rotation with them, you've just got to survive for a few months and then move on. Do that in the most professional and calm way possible, because those people have the potential to really,
ruin your career,
damage your personal brand and ruin your career. Yes.
Damage your personal brand, which is tantamount to ruining your career.
Yes.
So, I mean, it's a difficult one, isn't it? I suppose whilst there is the temptation to always lay blame or to identify blame in these dynamics, that's probably not very helpful, is it?
No.
Because a senior person would basically accuse the junior person of incompetence, and the junior person is basically going to accuse the senior person of bullying. So where do you draw the line? How do you deal with those conflicting barrages of accusations?
Well, I often, when it comes to blame, I often think about a model, the below the line and above the line behaviour model that's used a lot in business. And blame is one of those characteristics or behaviours that's a below the line behaviour. So I would never go to blame. I would always go above the line to an alternative, such as, making constructive and concerted efforts to resolve it professionally, bringing other people into it, talking about the situation rather than the people involved. So trying to disconnect that senior person from what's happening and talk about the situation rather than making it about them personally. And then, trying to come up with some solution. And often I hear people who've been through these experiences talk about things like saying to the person, look, if we can't agree on this, what are some things that you would suggest that I can learn from? How would you suggest that I learn from these in order to improve? So taking a bit of a dose of humility might help. But again, at the same time, you can't take so much humility so that you end up losing your own self-respect and the respect of that person. So it's a bit of a fine line. You've still got to be prepared to stand up for yourself and stand your ground and say, look, we disagree and it's okay to disagree. But I still stand by what I think, but I will respectfully acknowledge that we have a difference of opinion and we'll move on from there.
Right. So what I'm hearing is approach the individual first directly, and then if that doesn't work, then enlist local help and then enlist external help.
Yeah.
And, speaking as a former associate of the Australian Medical Association, I'm sure you'd agree that actually being part of a union is always a good thing as an employee. It doesn't matter what level you are in your career. Yeah,
it certainly can be a big help because you've got outside representation. You've got a third party who then goes in to negotiate on your behalf. But the other thing I'd just like to mention here, and I'm sure that all the listeners would already know this, but always avoid the temptation to badmouth the other person.
Yes, never speak ill.
Yes.
Never speak ill of the damned.
Yes, exactly.
Yes. So, yeah, that's actually a very important piece of advice, because if you do start speaking ill of someone that you have a big problem with, then and everyone hears about it, then everyone will start to think, well, actually, you're the one with the problem.
It undermines your own professional integrity. And I think that in these situations, you know, like I said, we can all agree to disagree, but you hold your head up and say, well, this is it. This is my position, and I'm moving on professionally through this, and I will come up with alternatives if this challenge is a significant one, like the example I gave. There's always a way around it, or another way.
So here's a question for you, just purely initially. Well, we'll see how it goes, but initially, hypothetically. Never speak ill of someone, right? If ill is never spoken of people, how then are the malignant characters in an organization, and there are a few, there's always a few, how are those malignant characters not dealt with appropriately?
Well, they should be. They're speaking ill in an unconstructive, sort of gossipy way, and there's providing constructive feedback to the organisation that you're working for.
Yeah.
So it all comes back to professionalism, because it is okay to comment on people's performance or behaviour in any organisation you're working for, But the unfortunate thing is that sometimes that feedback can fall on deaf ears and people don't want to know. And I have heard quite a few stories within medicine where, because of the position of a given person, say an extremely senior clinician and very well qualified person, people can turn the blind eye to their behaviour over long periods of time. And in that situation, I think, it's worth making every attempt to address that. But I have heard of people not being able to make any progress with that at all. So their option is to go elsewhere and go and work in another environment, because there are unfortunately still some situations where even the people highest up in the chain are still going to allow that behaviour to continue for other reasons. And it's not always evident what those other reasons are, because the relationships of those people isn't always known. The other things that say senior clinician might bring to that organisation may not be evident to others. So, personal people and their relationships within organisations can be very complex. And sometimes an organisation might think, well, we'll put up with that person because we have too much to lose if we don't. So,
and on that sweet note, Anita, I'm afraid we've run out of time.
Oh, no,
we've only even scratched the surface.
We did.
You'll have to come back again. We'll continue this chat later on.
All right. Thanks for
many thanks for your time tonight. Thank you.
It's a pleasure. Good to see you.
That's all for today's MedHeads. My name's Dr. Fergal Armstrong. Thanks for watching, and we'll see you next time.